Hi there, welcome to Documentation Basics, which is part 2 of the 90-day success program. Welcome back, glad you could make it. Today we are going to continue our conversation on what will help you be successful in your first days at Allume. So we're going to do a short recap of what the first section, the success workshop, was, and then we're going to talk about documentation. And specifically we're going to talk about why it's important and cover 3 different types of documentation, and you probably should only focus on the documentation that applies to you. So we're going to talk about the continuous care visit note, which is for all of you out in the field doing shift nursing. We're also going to focus on the med administration visit documentation, and also we're going to talk about home health aid, and each of those will be separate little modules that you can watch and learn from. So again, welcome to part 2. This is all about documentation, and you may recall that part of why we are bringing you together in this 90-day program is to help you learn about our culture, introduce remarkable care, help you understand our communication rituals, support your clinical excellence, and communicate our expectations, as well as establish some initial goals with you. So this is aligned with all of that and helping you understand how to document in the way that is appropriate. So before we go into documentation, I'm going to briefly go back and talk about for a second, just to refresh your mind and hopefully plant some seeds again around what you learned last time in the Success Workshop review. So first of all, a couple highlights. Allume is a term that means lit from within in French, and it is pronounced ah-LEW-may, ah-LEW-may, not Allume or Allume. It is ah-LEW-may, and so it's good to know how to say the company's name. We are a licensed, Connecticut licensed and Medicare, Medicaid accredited home health agency serving Western Connecticut, 69 towns, and we provide remarkable care 24 hours a day, 7 days a week. We also have a sister company we call Family Care Services that provides non-medical care, private duty services to seniors, households, children, and people with special needs. Our mission, which you'll hear us talk about all the time, is to gather, nurture, develop, and match people who genuinely love caring for others with families who need them. And our core purpose is to surround individuals, families, employees, and our communities with remarkable care. So here you see on this slide a picture of our service area. So you'll see that we cover a broad area, largely just focus our attention on the continuous care people that are in our area. Our office is, of course, in Watertown. And you're welcome to come and visit us anytime. We're always happy to see you. We talked in the last workshop, the Success Workshop, about what remarkable care is. And really what it is, it's all about having a high regard of impeccability for everything we do, whether it be the way we interact with others, the way we provide services or care to our patients, the way we connect with our employees, other employees, our team members, but it also means taking responsibility for all the things that come into our lives and trying to make sure we do the best we can. It also means trying to produce an emotional response, a positive experience for people who come in touch with us. And so hopefully the lasting effect is one that makes a person feel good. Which brings us to our intended feelings. We want to bring about feelings that are positive, and specifically the feelings we want people to feel, both our patients as well as our employees and anybody who connects with us as they meet us in the community, is we want people to feel cherished, respected, valued, and of course deeply cared for. So that's our wish, is for everyone to feel those feelings. And so as you step into people's home, I hope you bring that intention to help them feel cherished, help them feel cared for, help them feel valued and respected. We also talked last time, at our last success workshop, we talked about the 10 steps of remarkable care, and that it encompasses from beginning to end how to bring about remarkable care. And so the first step is to fill up your cup and do something good for yourself. Second thing is to be prepared before you go into a visit. To be prepared knowing what the plan of care is, know what the curated care plan is, so that you can go in and do whatever is needed for that family. Be on time, early even, arrive smiling at the front door exactly on time. Enter as preferred, so a lot of our families we're with for a long time, and so knowing what their rituals are, what their needs are, what their preferences for how people enter in and out of their home, it's very important. So enter as preferred. Then anticipate and fulfill wants and needs, which is largely following the plan of care, but also paying attention to the nuances that you might have in more of the curated care plan, knowing what the family likes, what is preferred, listening for spoken and unspoken needs, wants, and preferences. And then to leave a positive impact, the tidy, brighten, and enlighten step is really to leave every space that you touch a little bit better than you found it. Doesn't mean you have to scrub the person's home. That's not what we're asking. It means that you come in, you set your space, you make it nice, you make it comfortable, certainly make it clean. And then you, as you move through the house, through the home, through wherever, into somebody else's environment, that you tidy and brighten it, make it a little better. And then, important step, prepare for your departure. When you know that the little time is going to be ahead before you leave, before you do, prepare for your departure. Make sure that your materials are put away. Make sure that your communication logs, if there is a communication log, you're prepared to pass it on to the next person or caregiver, next nurse. Make sure that your patient has everything they need. Think in advance. Let them know, I'm going to be leaving in 20 minutes. Is there anything you need? And then when it's time to leave, provide a fond and caring farewell. And again, whatever preference, whatever way that family or patient desires. And then once you get back into your car, take a moment to review and report and innovate. So, track anything else that you haven't already tracked, either on written notes, if you're doing continuous care for right now anyway, or in Access. Report any new wants, needs, and preferences, certainly to your team, to your case manager, and identify new ways to bring your patient and families to remarkable care. And lastly, really important, it's a very big important part of the bringing light into people's homes, is the idea of taking a moment to just acknowledge yourself. Just, thank you, me. Thanks for taking the time. Thanks for doing amazing, remarkable care. Give yourself acknowledgement for whatever it is that you feel you need to be acknowledged for caring for others. So those are the 10 steps of remarkable care. Hope you bring them into your life all the time and into your patients' homes. And then the next thing we talked about, the last training, was the patient care process. And it's just important to be aware that there's all kinds of pieces happening and that everything is deeply connected. When you go in to provide care, that time and place where you provide care, know that there's all these other aspects that are going on, and be present to what your piece of that puzzle is and how what you do impacts everything else. Also know how those other players can be supportive to you if you need it. So you're not alone. Sometimes it might feel that way when you're out in the homes by yourself in those situations. You're not alone. You're surrounded by a team, and we want to support you. The best way to do that is to reach out to us, give us a call. I personally love to hear from all of you in the field, and would be delighted and honored to have lunch or connect, grab a bite to eat after work. But you gotta reach out to me and say, hey, I'd like to take you up on that. So I challenge you to do that. Send me an email, coco@allumecares.com. what is your role is the next thing we talked about. And so there's the case manager role, and then there's the direct care provider's role, and it's important to know the role so you can, feel supported and know what your case manager can do, how they can help you, and also know what you are expected to do. Very important is to always follow the plan of care, right? Always arrive at your shifts on time, arrive at your visits on time. Let us know well in advance if you're not going to be able to make it. The sooner the better, so we can try to get some help, some support to fill in for you if you can't be there. While you're there, be sure to recognize and report anything that's changing. Changes in condition need to be reported immediately to the case manager. Communication is key. And so today we're going to be talking about, in this section, we're talking about documentation, which sounds so dry and seemingly, trivial, and that you always have to hear about it. And we're going to talk about this topic once again, documentation, boring. But really, it's important because it instills a mode of communication and also safety for your patients, especially in home care, right? Because you don't have other people out there, like in a hospital or in a SNF. There's nobody else there to come and see what's happening with the patient to compare. So your documentation is the life source that's bringing from their home back to the office to your team, so you can make sure everybody's safe and the patient is cared for. So your documentation needs to be completed always the same day. You want to promote personal safety. You want to recognize and respond to unsafe situations, and you want to work together with your case manager and the rest of your team to provide remarkable care. So those are some of the things that goes on with your role. We also talked a little bit about mentoring and supervisory meetings. We like the term mentor versus supervisor. Mentor to us means that we're here to support you. We're here to help you grow. We're here to help you plan the development of your career, if that's important to you, or just to sharpen your saw to become better and better at what you do and feel good and acknowledged for what you do. So for LPNs, you're going to be seeing supervision at least monthly, and for home health aides, you're going to be seeing supervision twice a month, and at least once in person with the patient. And so for sure, make sure you reach out to your supervisor or mentor if they haven't had a meeting with you in a while, because that means something's wrong. They should be having meetings with you all the time. Then we talked a little bit about competencies. So you often think of competencies as those things that are very nurse or home health aide specific, and certainly we have that list of competencies, and you're going to see them again and again. We're going to talk about them, not today, but we'll probably talk about them next month. And we also have these other competencies we look for that are important, and they're things that will show up in your conversations with your supervisor. They're listed here. Things like how empowered are you? How detail-oriented are you? How professional are you? How trainable are you? How self-aware are you? Not that we're judging or grading, but these are the things we value. So these are things for you to reflect upon and bring to your job. These are things we expect and look for. So we are going to now move into the next piece. And I see I've spelled documentation wrong. Look at that, boom. So we're going to talk about documentation. This is the second part of the 90-Day Success Program. And in this, you're going to see less of me and more of others. But what we're going to do is we're going to talk about the important reasons why we look at documentation. So we're going to keep the patient safe by having a good communication tool. It also ensures that the care is consistent and high quality, because you're going to document everything you do. And your neighbor nurse is also going to document everything she does. And we're going to compare and make sure that everything is consistent and high quality. It allows us to also see patient needs more clearly when your documentation is well thought out and articulated. It's a very powerful form of communication. It's a powerful form of communication to your case manager, who can help mentor you and also be that voice that goes back to the doctor. In some cases, of course, you might also be that voice who reaches out to a doctor. but other nurses on the team as well. It's a way to communicate. The other thing that's important for you to understand too is that it is a form of documentation for the outside world that shows that you are providing careful, regulatory compliant care. So I mention it because that is how the DPH looks at it. It is how outside agencies would look at it. It's their way of knowing whether or not you and our team are providing quality, compliant care. So I mention it because it is an important part of the compliance process is to make sure your documentation is up to snuff. So always know that when we're asking for documentation, it's for these reasons, right? It ensures good communication, it makes sure the patient's safe, it looks for us to see whether if there are patient needs that aren't exposing themselves yet that need to be addressed. And altogether, this gives us a way to ensure remarkable care. It's just another lens to get into that important piece of remarkable care. So what's in it for you? We hope that this training that you're going to receive now, it will empower you so you'll know how to do it, and quality assurance will have less to send back to you. Hopefully it'll save you time because you'll know exactly what to do and you can sort of streamline your process. It'll create clarity. It'll support your growth as a clinician. It'll improve your clinical mastery. Being a good documentarian helps you actually do that. And it'll also open a dialogue for learning and support with your mentor. So we're going to break into 3 separate sections now. We're going to be focused on whichever section makes most sense for you to watch. If you're a supervisor, you should watch all of these. You should know how to do all of these things. If you are an LPN that does, or an RN who does continuous care shift work, certainly watch that particular video. If you're a home health aide, you should watch that home health aide video. And if, pretty much any nurse probably should know how to do the med admin piece. We occasionally will request people who are available to do that. And if you're able to jump out and do it, then you are able to provide a service to a family or patient who needs it. And for that, I am grateful. So I'm going to turn it now over to the next piece. Have fun.